Hi, my name's Nicholas. When I'm not doing my professional job, I do expedition kayaking. Right now, I'm kayaking a 600-kilometer paddle the entire length of Lake Malawi in East and Southern Africa. I'm talking to you from a beautiful beach that you can really only get to from kayak in a part of Mozambique. I'm also a cancer patient. Around 2010, I did a routine health medical check, and my doctor at that time said, there are some strange signals in your white blood cell count. So I went to a specialist. A few days later, I got the diagnosis of myelofibrosis.
Myelofibrosis is a rare chronic blood cancer and is part of a group of diseases called myeloproliferative neoplasms, or MPNs.
It's not like it's been an easy ride, not at all. Myelofibrosis manifests itself differently in people. With me, it's an enlarged spleen and extreme itching. It'll drive you mad. It's miserable. The itching is miserable. It's like pine needles on the inside of your body, scraping everywhere around your body.
JAKAFI or JAKAFI XR, ruxolitinib, is a prescription medication used to treat adults with certain types of myelofibrosis, MF. It is not known if JAKAFI or JAKAFI XR is safe or effective in children for treatment of myelofibrosis.
So I was very fortunate to get this diagnosis just when JAKAFI was coming through the proof of concept stage, and actual trials were successful. So I benefited from that.
JAKAFI or JAKAFI XR can cause serious side effects, including low blood counts. JAKAFI or JAKAFI XR, ruxolitinib, may cause low platelet, red blood cell, and white blood cell counts. If you develop bleeding, stop taking JAKAFI or JAKAFI XR and call your healthcare provider. Your healthcare provider will do a blood test to check your blood counts before you start and regularly during your treatment. Your healthcare provider may change your dose or stop your treatment based on the results of your blood tests. Tell your healthcare provider right away if you develop or have worsening symptoms, such as unusual bleeding, bruising, tiredness, shortness of breath, a fever. The most common side effects of JAKAFI or JAKAFI XR include, for certain types of myelofibrosis, MF, low platelet or red blood cell counts, bruising, dizziness, headache, and diarrhea. These are not all the possible side effects. Ask your pharmacist or healthcare provider for more information. Call your doctor for medical advice about side effects.
JAKAFI, which I started taking regularly since 2011, has an effect of tampering down that itching for me. It keeps my spleen from getting overly large. Over the past couple years, I've had a couple insurance glitches, and I haven't been able to access JAKAFI.
To help Nick restore his access to JAKAFI, he contacted Insight Cares.
I was actually in Insight Cares program. I benefited in terms of cost reduction and accessibility to the medications. And I think that type of program is hugely important. With JAKAFI, I have a trusted approach to addressing my cancer. I'm able to pursue my own personal passions. So this talk, I'm gonna dig a little deeper. Not be living my day in, day out thinking about my diagnosis. And it's not just about health. It's about family members. It's about being a productive member in society and living to your fullest. I like to reach new challenges. And perhaps my biggest challenge is gonna be myelofibrosis.
What is JAKAFI or JAKAFI XR? JAKAFI or JAKAFI XR, ruxolitinib, is a prescription medication used to treat adults with certain types of myelofibrosis, MF. It is not known if JAKAFI or JAKAFI XR is safe or effective in children for treatment of myelofibrosis. Important safety information. JAKAFI or JAKAFI XR can cause serious side effects, including low blood counts. JAKAFI or JAKAFI XR, ruxolitinib, may cause low platelet, red blood cell, and white blood cell counts. If you develop bleeding, stop taking JAKAFI or JAKAFI XR and call your healthcare provider. Your healthcare provider will do a blood test to check your blood counts before you start and regularly during your treatment. Your healthcare provider may change your dose or stop your treatment based on the results of your blood tests. Tell your healthcare provider right away if you develop or have worsening symptoms, such as unusual bleeding, bruising, tiredness, shortness of breath, a fever. Infection. You may be at risk for developing a serious infection during treatment with JAKAFI or JAKAFI XR. Tell your healthcare provider if you develop any of the following symptoms of infection: chills, nausea, vomiting, aches, weakness, fever, painful skin rash or blisters. Worsening of symptoms after interrupting or stopping treatment. Signs and symptoms of myelofibrosis may worsen after you stop treatment. Do not interrupt or stop treatment without talking to your healthcare provider. Tell your healthcare provider right away if you have any of the following after stopping treatment: fever, trouble breathing, weakness, night sweats, feeling dizzy or lightheaded, pain in left upper stomach area or left shoulder. Cancer. Some people have had certain types of non-melanoma skin cancers during treatment with JAKAFI or JAKAFI XR. Your healthcare provider will regularly check your skin during your treatment. Tell your healthcare provider if you develop any new or changing skin lesions during treatment. Increases in cholesterol. You may have changes in your blood cholesterol levels during treatment with JAKAFI or JAKAFI XR. Your healthcare provider will do blood tests to check your cholesterol levels about every 8 to 12 weeks after you start taking JAKAFI or JAKAFI XR and as needed. Increased risk of major cardiovascular events, such as heart attack, stroke, or death, in people who have cardiovascular risk factors and who are current or past smokers, while using another JAK inhibitor to treat rheumatoid arthritis. Get emergency help right away if you get any symptoms of a heart attack or stroke during treatment with JAKAFI or JAKAFI XR, including discomfort in the center of your chest that lasts for more than a few minutes or that goes away and comes back, severe tightness, pain, pressure, or heaviness in your chest, throat, neck, or jaw, pain or discomfort in your arms, back, neck, jaw, or stomach, shortness of breath with or without chest discomfort, breaking out in a cold sweat, nausea or vomiting, feeling lightheaded, weakness in one part or on one side of your body, slurred speech, increased risk of blood clots. Blood clots in the veins of your legs, deep vein thrombosis, DVT, or lungs, pulmonary embolism, PE, have happened in people taking another JAK inhibitor for rheumatoid arthritis and may be life-threatening. Tell your healthcare provider right away if you have any signs and symptoms of blood clots during treatment with JAKAFI or JAKAFI XR, including swelling, pain, or tenderness in one or both legs, sudden unexplained chest or upper back pain, shortness of breath or difficulty breathing, possible increased risk of new, secondary cancers. People who take another JAK inhibitor for rheumatoid arthritis have an increased risk of new, secondary cancers, including lymphoma and other cancers. People who smoke or who smoked in the past have an added risk of new cancers. The most common side effects of JAKAFI or JAKAFI XR include, for certain types of myelofibrosis, MF, low platelet or red blood cell counts, bruising, dizziness, headache, and diarrhea. These are not all the possible side effects. Ask your pharmacist or healthcare provider for more information. Call your doctor for medical advice about side effects. Before taking JAKAFI or JAKAFI XR, tell your healthcare provider about all the medications, vitamins, and herbal supplements you are taking, your medical conditions, including if you have or had low white or red blood cell counts, have an infection, have or had tuberculosis, TB, or have been in close contact with someone who has TB, had shingles, herpes zoster, have or had hepatitis B, have a high level of fat in your blood, high blood cholesterol or triglycerides, have or have had a blood clot, heart attack, other heart problems, or stroke, are a current or past smoker, had cancer, have or had liver or kidney problems, or are on dialysis. If you are on dialysis, JAKAFI or JAKAFI XR should be taken after your dialysis. Have any other medical condition. Women should not take JAKAFI or JAKAFI XR while pregnant or planning to become pregnant. Do not breastfeed during treatment with JAKAFI or JAKAFI XR and for 2 weeks after the final dose. How should I take Jakafi or Jakafi XR? Take exactly as your healthcare provider tells you. Do not change your dose or stop taking Jakafi or Jakafi XR without first talking to your healthcare provider. If you stop treatment, symptoms of your condition may return. If you miss a dose, take your next dose at your regular time. Do not take 2 doses at the same time. You may have regular blood tests during your treatment. Based on the results, your healthcare provider may change your dose or stop Jakafi or Jakafi XR. If you are prescribed Jakafi, take Jakafi 2 times a day or exactly as your healthcare provider tells you, with or without food. Jakafi may also be given through certain nasogastric tubes. Tell your healthcare provider if you cannot take Jakafi by mouth. Your healthcare provider will decide if you can take Jakafi through a nasogastric tube. Ask your healthcare provider to give you specific instructions on how to properly take Jakafi through a nasogastric tube. If you are prescribed Jakafi XR, take Jakafi XR 1 time a day with or without food. Swallow Jakafi XR whole. Do not split, crush, or chew. Please see the full prescribing information, including patient information, which includes a more complete discussion of the risks associated with Jakafi or Jakafi XR at jakafi.com. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You may also report side effects to Insight Medical Information at 1-855-463-3463.